Hello, everyone. My name is Ruby, and I'm here with Sophia. Our stance is to disprove that selenium supplementation helps or prevents cardiovascular disease. Selenium is a powerful trace mineral that produces enzymes with antioxidant properties called glutathione peroxidases, which protect against oxidative stress and provide protective effects against atherosclerosis by reducing atherosclerotic lesions in arteries. A risk factor for cardiovascular disease is selenium deficiency. However, supplementing with selenium does not help prevent or treat cardiovascular disease as it's not supported by any substantial evidence. In 2020, Jenkins and Associates published a systematic review examining cardiovascular disease and mortality in adults who took selenium with antioxidant mixtures. There was a decreased cardiovascular disease risk when selenium was combined with other antioxidants, but the results indicated no association was seen when selenium alone was supplemented. A 5-year prospective randomized double-blind placebo-controlled trial called the KEYSEL-10 study investigated cardiovascular disease mortality in elderly adults who took selenium combined with coenzyme Q10. Their results indicated that there was more than 50% cardiovascular disease mortality reduction after taking the combination for 10 years. The different formulas of selenium combined with other micronutrients do not indicate that selenium alone provides any cardiovascular benefits. Meta-analysis and systematic reviews published by Reese and Associates in 2013, Benstone and Associates in 2015, Currier and Associates in 2020, and Jenkins and Associates in 2020 have determined inconclusive and inconsistent research evidence on selenium supplementation benefits for cardiovascular disease health.
One of the cardiovascular disease risk factors is increased blood lipid levels and increased blood pressure. Interestingly, we found that in the studies where selenium supplementation is used without additional ingredients, there was a lack of blood pressure measurements. This is mentioned in the review by Reese and Associates. In addition, mortality or cardiovascular disease events were not significantly affected by selenium supplementation alone. A 2013 review article by Reese and Associates solely looked at random controlled trials that used selenium supplementation on its own. The review included studies of selenium supplementation effects on major cardiovascular disease endpoints, mortality, and cardiovascular disease risk factors such as blood lipids and blood pressure for adults of all ages, as well as those with a high risk of cardiovascular disease. Some short-term studies, such as 3 months, were included, but the majority of the data came from studies with a duration of 6 months or more. All included studies used a comparison group with a placebo and a no intervention comparison group. Of the 19,715 randomized participants, no statistically significant effects of selenium supplementation were found for all-cause mortality, cardiovascular disease mortality, or cardiovascular disease events. A meta-analysis by Currier and Associates in 2020 looked at articles attempting to discover a relationship between high selenium status in the body and a reduced incidence of cardiovascular disease or death. Their analyses included 13 articles that measured selenium at baseline. Selenium was taken from participants' blood, plasma, or toenails. Although they concluded that there is an association between high selenium levels in the body and a reduced incidence of cardiovascular disease and death, they only measured selenium at baseline, and this was a major limitation as selenium status may have fluctuated for the duration of the study. In addition, the articles do not measure the effect of selenium supplementation. They measured selenium status only. Selenium supplementation may have a positive association with preventing or treating cardiovascular disease, but if a person does not have a deficiency to begin with, this may not be the case. Review article by Bomer and Associates from 2022, looking at how selenium levels relate to heart failure, also notes the plausibility that only patients who have evidence of selenium deficiency may benefit from the supplementation. In conclusion, there is limited trial evidence to support the use of selenium supplementation in the prevention or treatment of cardiovascular disease. High-quality random control trials are needed for strong conclusive evidence. Thank you.